Here's something most men over 50 have no idea about. Your body is quietly shrinking a part of you every single year, and by the time you notice, you've already lost ground you didn't have to lose. But here's the good news I wish every one of you knew decades ago. This isn't aging, you just have to accept. About 90% of it is reversible, preventable, or at the very least, something you can slow way down. I'm Dr. Grace Holloway. I've been practicing urology and men's health for over 20 years here in the States. And in the next few minutes, I'm going to walk you through exactly what's happening down there as you age, and more importantly, what you can do about it starting today, no matter if you're 40, 60, or even 75. Before I dive in, I want to ask you something, and I genuinely want you to answer me in the comments below. How old are you? Drop your age down there. I read those comments, and it helps me make content that actually serves the folks who are watching, not some imaginary audience. Whether you're in your 30s, getting ahead of the curve, or you're pushing 80 and wondering if there's still hope, I want to know. Because what I'm about to share applies differently depending on where you are in life, and I'm going to break it down by age group so nobody feels left behind. Now, let me get something out of the way first, because I had a patient just last month, a sharp guy, 71, retired engineer from Ohio, sit down in my office looking embarrassed. He told me he'd noticed things were smaller than he remembered from his 50s, and he figured he'd missed the boat. He told me, and I'll never forget this as Doc, if only I'd known about this 20 years ago. And I told him what I'm telling all of you right now. It is never, ever too late. Is it easier to start at 40? Absolutely. But men in their 70s and 80s can still make meaningful improvements in tissue health, blood flow, and function. So if you're watching this thinking, you're too old, stop. You're not. Keep watching. Okay, let's get into the science of what's actually happening, because I've found that when men understand the mechanism, they're 100 times more likely to actually do something about it. In medicine, we call this penile atrophy. And the research in journals like the Journal of Sexual Medicine and the International Journal of Impotence Research is crystal clear on this. Penile tissue, just like every other tissue in your body, your heart muscle, your brain, your kidneys, needs a steady, generous supply of oxygenated blood to stay healthy. When that blood flow drops off, the tissue suffers. It loses elasticity, it loses structural integrity, and yes, it physically shrinks. Here's what most guys don't realize. The very first sign of cardiovascular trouble in your body often shows up down there, not in your chest. Studies have shown that endothelial dysfunction, that's damage to the inner lining of your blood vessels, can show up in penile arteries 3 to 5 years before it shows up in your coronary arteries. Think about that. What's happening below the belt is an early warning system for what's coming for your heart. So when I see a patient with erectile changes, I'm not just thinking about his bedroom life. I'm thinking about his ticker too, and you should be thinking about it that way also. Your body, in its infinite practicality, prioritizes blood flow to organs it considers essential for survival. Your heart, your brain, your kidneys. Unfortunately, from an evolutionary standpoint, your body does not consider the penis essential for keeping you alive. So when circulation starts getting tight, guess where it gets cut off first? You got it. That's why vascular health and penile health are basically the same conversation. Now let me break down the specific things that contribute to these changes, because there are several, and they all stack on top of each other. First, nocturnal erections. When you were in your 20s, you were having 5 to 8 erections a night while you slept. You didn't even know about most of them. These aren't just random. They're your body's built-in maintenance system. Every one of those nighttime erections is flooding penile tissue with oxygen-rich blood, keeping everything supple and healthy. As you age, the frequency of these drops significantly. By the time a lot of men hit their 60s, they might be having 1 or 2 a night, sometimes none. That's a massive reduction in automatic tissue maintenance, and your body feels it. Second, sexual activity in general tends to decrease with age, whether it's because of a partner's health, a divorce, widowhood, stress, or just life getting in the way. Every erection, partnered or solo, is essentially a workout for your penile tissue. The research consistently shows men who stay sexually active, and I mean any kind of healthy sexual activity, maintain better function throughout their lives. This is where the old saying comes in. And folks, it's not just folk wisdom, it's biology. Use it or lose it. I cannot say this enough. That phrase should be printed on every man's bathroom mirror. Third, testosterone. Starting around age 30, your testosterone drops about 1 to 2% per year. Most guys lose it slow enough that they don't notice until they wake up one day at 55 feeling tired, foggy, and not all that interested. Low T doesn't just affect your libido. Research out of the Journal of Clinical Endocrinology shows it directly contributes to tissue atrophy down there over time. Fourth, and this one's huge, metabolic health. Insulin resistance, belly fat, inflammation. These are quiet killers for men's sexual health. A study in the Journal of Sexual Medicine found that men with waist circumferences over 40 inches had significantly smaller penile measurements than men with healthy waistlines. Part of that's visual. Yes, fat pad coverage hides length, but a big chunk of it is real, measurable tissue change caused by insulin resistance damaging blood vessels and interfering with testosterone function. So if your belt has been loosening in the wrong direction for a while, that matters down there too. Now, before we talk prevention and treatment, I want to clear up something one of my patients asked me recently, because I bet some of you are confused about this too. There's a difference between temporary shrinkage, the kind that happens after cold water, or when you're stressed or when you're sick, and progressive atrophy. Temporary shrinkage is just blood leaving the area for a bit. It comes right back with warmth and relaxation. Every man alive has experienced it, and it means absolutely nothing about your long-term health. What we're talking about today is the slow, year-by-year tissue loss that actually changes your baseline. Two completely different things. Don't let a cold swimming pool convince you something's wrong. All right, let's talk about what to actually do. I'm going to give you 6 prevention strategies first, and then 6 strategies for men who are already noticing changes. And I want you to listen based on where you are in life. If you're in your 30s or 40s, you're in the best possible position. Focus heavy on prevention, steps 1 through 6 coming up. Build the foundation now, and you'll be thanking yourself at 70. If you're in your 50s or 60s, you want both. Prevention plus some of the early intervention strategies. You still have tons of room to improve. If you're 65 and up, don't skip the prevention stuff, but pay extra attention to the intervention section. And remember what I told my patient from Ohio. It's not too late. Okay, prevention strategy number 1. Eat for your blood vessels. Specifically, eat foods that boost nitric oxide production. Nitric oxide is the molecule that tells your blood vessels to open up and let blood flow in. Without it, an erection doesn't happen. Period. The foods that boost nitric oxide naturally include leafy greens like spinach, arugula and kale, beets, pomegranate, and citrus fruits. A study in the International Journal of Cardiology found men eating nitrate-rich foods had about 30% better erectile function scores than guys who skipped them. 30%. That's not a small number. Number 2, get enough magnesium. Most American men are magnesium deficient and have no idea. Magnesium supports vascular health, smooth muscle function, and testosterone production. Get it from almonds, pumpkin seeds, cashews, dark chocolate, and those same leafy greens we just talked about. Aim for around 400 milligrams a day from food. Number 3, cut the ultra-processed junk. I'm talking about the stuff that comes in a plastic wrapper with 20 ingredients you can't pronounce. Chips, fast food, sugary cereals, sodas, packaged pastries. These foods drive inflammation and insulin resistance, which we already established, are direct threats to everything we're trying to protect. Men who follow a Mediterranean-style diet, lots of olive oil, fish, vegetables, nuts, moderate red wine, consistently show better sexual function into older age. You don't have to be perfect. Just shift the ratio. Number 4, manage your waistline. This one's tough to hear, I know, but if your waist is over 40 inches, that abdominal fat is actively hurting your sexual health in multiple ways. It's not about looking good at the beach, it's about the metabolic chaos that fat is causing inside your body. Number 5, move every single day. I'm not asking you to become a marathon runner. Walking briskly 30 minutes a day, 5 days a week, does wonders for vascular health, insulin sensitivity, and testosterone. Add in some resistance training a couple times a week and you've got yourself a hormone-boosting, circulation-improving program that would cost you a fortune if it came in a pill. which it doesn't, because it can't. Number 6, protect your sleep. This is the one nobody takes seriously, and it drives me nuts. Most of your testosterone production happens during deep sleep. Those nighttime erections that maintain tissue health, they happen during sleep. Men sleeping less than 6 hours a night have significantly lower testosterone and worse sexual function. 7 to 8 hours. Dark room. Cool temperature. No phone in bed. Treat sleep like the medicine it is. Now, for those of you who are already noticing changes, or who just want to be more proactive because something feels off, here are 6 strategies backed by real clinical evidence. Step 1. Target your blood vessels with specific nutrition and supplements. Vitamin C, around 500 to 1,000 milligrams a day, has been shown in controlled trials to improve endothelial function. Flavonoids from berries, dark chocolate, and citrus support nitric oxide availability. L-arginine, an amino acid, has research behind it for erectile function. Typical doses in studies are around 3 to 6 grams a day, usually split across the day. Pomegranate extract and French maritime pine bark extract, also called pycnogenol, both have solid evidence for vascular and erectile health. Pine bark studies often use around 100 to 200 milligrams a day. Now, I want to be clear, these are not magic pills. They're tools, and you absolutely should check with your own doctor before adding supplements, especially if you're on blood thinners or blood pressure medication. Step 2, and I know this one raises eyebrows, but the research is what it is. Consider a vacuum erection device under medical supervision. These devices have been used in urology for decades, especially for men recovering from prostate surgery. The research in the Journal of Sexual Medicine shows vacuum therapy helps maintain penile length and function. The mechanism is simple. It creates controlled blood flow to the tissue, giving it the oxygenation it would get from a natural erection. But I want to emphasize, talk to a urologist first. Use only FDA-approved devices. Men with certain bleeding disorders or sickle cell disease shouldn't use them. Done right, with medical guidance, it's a legitimate tool. Step 3, stay sexually active. I mean this, partnered, solo, whatever your situation. Regular erections are tissue maintenance. If you're single, widowed, divorced, whatever, don't write this part of your life off. Your body doesn't care about your marital status. It just needs the blood flow. Step 4, check your testosterone if you're having symptoms. Fatigue, brain fog, low drive, trouble maintaining muscle, mood changes. These are low T signs. A simple blood test from your doctor will tell you where you stand. If your levels are truly low and you have symptoms, testosterone replacement therapy, done properly under a qualified doctor's supervision, can make a significant difference. But please, don't buy testosterone from some sketchy online clinic that's going to hand it out without proper monitoring. This is a hormone, not a vitamin. It needs real medical oversight. Step 5, if you're carrying excess weight around your middle, losing it helps in multiple ways at once. Better insulin sensitivity, lower inflammation, better testosterone utilization, and yes, a better visual appearance because less fat pad means more of what you've got is visible. Men who lose significant abdominal weight often tell me they feel like they've added an inch, and honestly, in a very real sense, they have. Step 6, build a routine and be consistent. This stuff doesn't work in 2 weeks. It works over months and years. I've watched patients in their 60s completely turn things around over the course of a year of consistent effort. I've also watched 40-year-olds do nothing and be in bad shape at 50. Consistency beats intensity every single time. Now, I want to address something I see in the comments of videos like this all the time. A lot of you have told me you've been to your regular urologist or primary care doc and felt brushed off. You've been handed a prescription for the little blue pill and sent on your way. Some of you couldn't even afford it. Some of you didn't need it and knew it. I hear you. And I want to say, the standard 10-minute medical visit is just not set up to have this conversation properly. That's part of why I make these videos, because the education most men need about their own bodies isn't getting delivered in the exam room. It's up to you to educate yourself, and I'm here to help you do that. I also want to speak to one question that came up recently from a viewer who asked whether women experience anything similar. The short answer is yes. Women do experience age-related changes to vaginal tissue, often related to estrogen decline after menopause. It's a whole conversation of its own, but the underlying principles, blood flow, hormone balance, regular activity, are remarkably similar for both sexes. If you're watching this with your wife or partner, this stuff is relevant for both of you, just with different specifics. Let me share one more thing from the clinic before we wrap up. The men who do best long-term are not the ones looking for a magic bullet. They're not the guys buying every supplement on the internet or chasing miracle cures. The men who do best are the ones who take a comprehensive approach. They clean up their eating, they move their bodies, they sleep, they address their hormones if needed, they stay intimate with their partners, and they take a long-term view. This is exactly the same playbook as keeping your heart healthy or your brain sharp. Sexual health is not separate from general health. It is general health, just expressed below the belt. And let me be honest with you about expectations, because I'm not going to sell you a fairy tale. You're not going to reverse 40 years of aging in a month. That's not how bodies work. What you can realistically expect, with consistent effort, is improved function, improved firmness, better stamina, better confidence, and in many cases, measurable improvements you can feel and your partner can feel. Some men see dramatic improvement. Some men just slow the decline. Both outcomes are enormous wins because the alternative is doing nothing and watching things get worse. If you take nothing else from this video, take this. Your sexual health is worth investing in. It matters for your confidence, your relationship, your quality of life, and frankly, your sense of yourself as a man. Don't let shame or embarrassment stop you from taking action. Don't let a dismissive doctor stop you. Don't let your age stop you. And please, don't let anyone convince you this is just something you have to accept. It isn't. There is so much you can do. Here's what I want you to do right now before you close this video. First, tell me in the comments, which age group are you in and which of these strategies are you going to start with this week? I read every single comment. Second, if you got value from this, hit the like button. It helps me reach more men who need this information. Third, subscribe if you haven't, because in my next video, I'm going to break down 3 everyday foods that seem healthy but are actually tanking testosterone in men over 50, and you don't want to miss that. And if you want me to do a deep dive video on vacuum therapy specifically, the how-to, the do's and don'ts, what to look for in a device, comment the word device below and I'll put it at the top of my list. Take care of yourselves, everyone. 20 plus years of practice has taught me one thing above everything else. The men who thrive in their later decades are the ones who decided, at some point, that they were worth the effort. You are worth the effort. I'll see you in the next one.